Thank you, Ed. The nonverbal hypnotic induction, which I will demonstrate, was developed by combining the various steps into a procedure which I have found to be a very effective induction technique. During the early development phases, I conducted extensive interviews with participants to solicit their input and feedback for improvement. You, as a hypnotist, can add this technique to other inductions which you are currently using. It is quick, it is easy, it is effective. Do you know much about nonverbal communications?
No, guess I don't.
What does it mean when you're seated in a congregation and a minister does this?
Stand up.
And what does it mean when he does that?
Sit down.
And when somebody does this, what does that mean?
Come over here.
And what does it mean when someone does this?
To be quiet.
So you know a lot more about nonverbal communications than you give yourself credit. Will you agree to follow along with me nonverbally?
Yes, I will.
Now, I don't know if your eyes are going to be closed or not, but when I touch you right there, that is a signal for you to open your eyes.
Okay.
This is an example of a silent induction. This is what is called a non-verbal induction. Almost all of us are familiar with the techniques of verbal induction. We use them every day. We use inductions where we hypnotize people using words. But suggestion can come in many forms. And there are many, many examples of the use of hypnosis today by therapists of all kinds. For example, massage therapists, chiropractors, people who use acupuncture and acupressure are using techniques of silent or physical induction. This is an example of some of those techniques. These particular techniques are combined in ways where the suggestion is enhanced. It is increased most effectively by the use of physical touch and physical pressure. Mr. Howell has developed these techniques over many years by practicing with many, many people, and he has seen and he shows and demonstrates how this can be used very, very effectively. He is showing ways where a person can be hypnotized and given suggestion without saying a word. He's showing examples of people being induced into the hypnotic state, or what we call the hypnotic state, merely by suggestion caused by physical movement, caused by physical pressure, physical touch. And at the same time, these same suggestions are used to deepen the state. It appears that after a while, a person who is induced into the hypnotic state in this way is in a fairly deep state. This state appears to be one that is very productive for many, many applications of hypnosis. This technique can be applied in many ways, and it can be used with people who do not even speak the language. We have used examples of this with people who do not speak English, or monks, or the person who was demonstrating the technique did not speak their language, and yet they were able to go into this same deep hypnotic state very quickly. It not only is a silent technique and a very effective, proven technique of inducing the hypnotic state, but it also can be used in all applications, including therapeutic hypnosis, to help people who don't understand what hypnosis is all about to be able to go into the hypnotic state. If you'll notice in the beginning, Mr. Howell did not even mention the word hypnosis. He talked about nonverbal suggestion and going along with a non-verbal communication experiment. This can be very helpful in working with people who are afraid of the tool of hypnosis. This is an excellent example of how hypnosis can be used in many, many ways to help people in all walks of life.
This is part 2, which will consist of the demonstration and an explanation of each step. Select a straight back chair without armrest. This technique may be used for different applications. For demonstration and training purposes, you would want to request a volunteer from the audience. Once you have a volunteer, you would want to introduce yourself to them. You would want to express appreciation for them agreeing to participate. You would want to secure their cooperation by asking them, will you cooperate with me? This provides you an opportunity to establish some rapport with them. You notice the gesture which I just made. That is a fairly universal example of nonverbal communication, which establishes the yes set. Another application would be with a client during a therapy session. Obviously, you would have already established rapport with the individual during the pre-hypnosis interview, and they would probably already be seated. I would emphasize that you practice this technique so that you develop a smooth transition from one step to the other. The first question that you ask the individual is, do you know much about nonverbal communications?
No.
That is the normal response that you will get from the majority of the people. I then ask them the following series of questions to establish some nonverbal communication understanding between the participants and myself. What does it mean when you're sitting in a congregation and the minister does this?
To stand up.
And what does it mean when he does that?
To sit down.
And what does it mean when someone does this to you?
Come over here.
And what does this mean?
To be quiet.
So you know a lot more about nonverbal communication than you're giving yourself credit. They responded no to your question, do you know much about nonverbal communication? And I think by telling the individual that they do know more about nonverbal communication than they give themselves credit has a reassuring quality for the participant. Will you agree to follow along with me nonverbally?
Yes, I will.
Okay. I don't know if your eyes are going to be closed or not, but when I touch you right there, that is a signal for you to open your eyes.
Okay.
You have established a tactile cue for them to open their eyes, which is also referred to in the literature as an anchor. You then want to take your right hand and grasp their right wrist. Now, if they have a long sleeve blouse, a shirt on, or if they have some jewelry here, you want to move it up so that you can very comfortably and easily grasp the wrist. And you then want to do an eye fixation on the fingertips. You want to hold the fingers about 8 to 10 inches out in front of the individual. And frequently a participant will look up at you, and when they do, you just want to lean back, refixate the eyes on the fingertips in this manner. You then want to achieve eye closure. Occasionally, a participant will open their eyes, make another pass down over their eyes. If they continue to open their eyes, just take your left hand with your little finger and the outside edge of your hand and apply a mild pressure on their eyelids, signaling for them to keep their eyes closed. During one of many applications of this technique, I had an individual who continued to keep her eyes open, and only one time, and I verbally instructed her to please keep your eyes closed until we were through. Of course, that showed resistance on her part. You then reach around with your hand turned in this manner and grasp their left wrist and bring it right up like this and around behind their neck, gradually pulling your left hand down along theirs and just sort of pressing in at the fingertips. You then want to achieve arm catalepsy. And you need to observe the individuals. If the hand starts back down, just reach up there and tug on it like this, locking the elbow in. Now then allow approximately 10 seconds to give the trance state an opportunity to deepen. You then grasp the right arm in this manner, lowering the arm and releasing the catalepsy. And you want to signal to them to allow the arm and muscles to relax. You then drop the hand right on their leg. During this particular step, you need to be careful and pay particular attention when you're releasing the arm, because if you release it too far out here to the left, it'll slide off to the side. So have it about 4 to 6 inches right above the leg and just drop it. Subsequent interviews of participants have revealed that sometimes a person experiences a paresthesia when you drop the hand on the leg. You carry out the same procedure with the left arm. You then take the left hand and apply pressure to the back of the neck. Take the thumb and index finger on your right hand and apply mild pressure to the forehead. During this step, I would apply about the same amount of pressure to the back of the neck as I'm applying to the forehead. The next step, you would place your hands very gently on the person in this manner and observe the person's chest, and you want to apply pressure as they are exhaling. Release the pressure when they inhale, apply the pressure as they exhale. Release the pressure, apply it as they exhale. This gives you an opportunity to pace their breathing with pressure techniques, and you've probably used pressure techniques in deepening the trance state with other inductions. You then place your hands in this position, and you want to be particularly cautious with the next step. If the person has experienced a neck injury or they are experiencing neck pain, you would want to skip this step. Apply the hands in this position and start rotating the head. Very gently, very easily, and very casually. With any of these moves, you do not want to do anything that's real abrupt or real jarring. A smooth, even, fluid motion. If you notice that the person is assisting you, just stop the rotation and reverse it in the other direction. Some participants have reported experiencing a mild disorientation sensation during this step. You want to be particularly careful when you're working with a lady that you do not want to mess her hair up, or you do not want to smear her makeup. You then apply mild pressure to this area right here. And then to the other side. You then repeat this step and like with any other induction technique. After you make a suggestion, whether it's verbally or non-verbally, you want to pause and wait just a moment or two to allow the suggestion to take effect. I would encourage you as a trained professional to practice this technique in the systematic manner in which it was demonstrated. Your proficiency in this technique will benefit you as well as those you serve. I would like to express appreciation to Dr. Ed Martin for his encouragement and support in the documentation of this nonverbal hypnotic induction. Thank you.